Andro. And today it is a moment of extreme pleasure to welcome our very acclaimed doctor, Dr. Rakhee Sahu, who is present here with us, and she will be answering some of our questions regarding today's topic, which is bone health in menopause. And doctor, before starting, please tell our viewers something about yourself.
Thank you, Ria, for your kind introduction. I am Dr. Rakhee Sahu. I am a gynecologist and obstetrician. I have been practicing for last 20 years. I started my career as an assistant professor at Narikaa Hospital, maternity home. Then I joined Hiranandani Hospital, Dr. L.H. Hiranandani Hospital, which is at Powai. I'm a consultant and I've been practicing for last 10 years at Hiranandani Hospital. My field of interest are mainly in obstetrics. As an obstetrician, I love delivering babies, but I have a keen interest in laparoscopic gynecological surgeries, and of course we also cater to a lot of geriatric population where they are dealing with menopausal issues.
Thank you, doctor. And doctor, at what moment would you say was the moment when you decided to become a doctor?
I think by teenage you know what is your niche and what would you like, mathematics or biology and zoology. I was very inclined in the medical field right from my start. I remember maybe our times it was easier to get into medical profession. We had to study PCB and we got admission into medical college. It was a local medical college. I did my graduation from Grant Medical College, Mumbai. Then I did my post-graduation from Lokmanya Tilak Medical College, and then I have been at Narikaa.
Well, doctor, that was really a great response. And moving on to the questions now. So doctor, what is osteoporosis?
Ria, osteoporosis basically means it's a disease of the bone where the bones become weaker, so they are more prone to trauma, they become brittle. So how the bone density decides the strength of the bones. When the bone density is decreasing, that's the time we say it is osteoporosis. We all human beings are meant to age. By 50s and 60s, there is more of osteoclastic production in our body, so our bones tend to become weaker. But we could maintain the bone health by taking early life precautions.
Osteoporosis develop?
As I told you, with age, bones would start to weaken up. Means there is a continuous remodeling of the bone. The bones keep on getting reabsorbed and there is bone formation at the same time. But if there is a premature bone absorption and the reproduction of the bone is not at par, that's the time the bone density keeps on becoming weaker, lesser, and the bones become prone to fractures and arthritic changes very early in life. Suppose somebody lands up with an accident, a major trauma, a force which is going to break the bones, it is understood that it is due to the trauma, like vehicular accidents, we do land up with people with skull fracture, with humerus, femur fracture. But with age, we see that when the bones are brittle, even trivial injuries or jerks could give them, fractures of the bone. Like simple somebody, an old age lady or a man slips into the bathroom and they land up with a spine fracture or with a hip joint fracture.
And doctor, as the topic itself says, bone health in menopause. Right. So doctor, what is menopause?
As a gynecologist, we deal with ladies all throughout the reproductive age. Menarche means when the girl starts getting her first period, that is menarche. That starts around 11 to 13 years of age. Then it gradually progresses and the peak of the reproductive age is between 20 to 35. Menopause means when this hormonal level starts declining, means every decade, 30, 40s and 50s, the hormonal changes in the ovaries keeps on happening and it declines the production of estrogen and progesterone hormone. Menopause basically means when this lady ovaries would stop functioning and she would stop to get her menstrual cycle monthly, which she was bleeding every month, would decrease, would gradually go away. And when a woman has not bled for complete 1 calendar year, that's the time we say, okay, she has reached menopause. Any bleeding after menopause is supposed to be not good, pathological, and she is supposed to report to the gynecologist.
Yes, doctor. And doctor, how is osteoporosis related to menopause?
As I told you, till the age of 50, her estrogen hormones is keeping her bone, her skin, her hair, her lipid profile, her heart, everything better than the men. Like we see that ladies have less cardiovascular diseases or osteoporosis before the age of 50. But after the age of 50, it's like, in fact, it becomes double than the men population because of the lack of estrogen. So menopause and osteoporosis are correlated, and we have to start taking preventive measures before osteoporosis sets in. Means every lady more than the age of 50 or somebody with premature menopause would need to start taking calcium supplements before her bones become very brittle. They undergo a lot of absorptive changes, and the bones don't regain their calcium content and their density very easily.
And doctor, what are the other diseases that can cause the osteoporosis?
Right. Now, there are many medical conditions which could predispose a lady to osteoporosis. Like suppose she is into any autoimmune disease, like she has rheumatoid arthritis, she has asthma, and she's been put on certain corticosteroids like dexamethasone, betamethasone, all kinds of steroids predisposes the bones to osteoporosis when especially they are long standing. Like these patients would be on low dose steroids due to their autoimmune conditions for a long period. Then there could be certain gastrointestinal diseases like ulcerative colitis, that could be Crohn's disease, where their intestinal absorption of calcium and protein is not optimal, and that leads to osteoporosis. Then certain hormones like parathyroid hormone dysfunctions and thyroid hormone dysfunctions. Parathyroid hormone is an important hormone which is responsible for the metabolism and absorption and reabsorption of calcium, phosphorus and vitamin D. So when this hormone is deficient or in high in content, that's the time especially when there is an increased parathyroid hormone, you could have hypercalcemia, and this could present with muscle fatigue, osteoporosis, joint pains, and twitching in the lower limbs or the upper limbs. Second is vitamin D3 and B12 deficiency and phosphorus deficiency. All this is needed for bone formation and bone absorption.
Yes, doctor. And as we talked about so much about osteoporosis, so the viewers would like to know the symptoms of osteoporosis.
Right. Now, as the bones become brittle, which are the most weight-bearing bones of our body is one, the spine, second, the hip joint, and the knee joint. The small joints are not really affected by osteoporosis. The small joint pains and aches and swelling are more into rheumatoid arthritis. When you're looking at osteoporosis, these are the bones. Like if your vertebra, they're like bricks of stack of bricks. If they start becoming porous, they tend to collapse, and that leads to compression of the nerves, and it could give pain, tingling, numbness. Second, the vertebral column bodies could collapse, and they could also lead to prolapse intervertebral disc, which can also give pain and extreme pain, especially in prolonged standing or doing any kind of weight-bearing exercises. Then comes the hip joint and knee joint, and hip joint is typically the neck of the hip joint is the thinnest part, and that is what is prone to avascular necrosis. So hip joint disorders are very common. Second is knee joint. When the knee joints bone space is reducing, they tend to rub, there is more friction, and that leads to pain and swelling. So the lady would experience a lot of pain when she is trying to squat down, or when she has to bend a lot, she has to do household chores which are in a sitting position. That's the time she will complain of pain.
Yes, doctor. And doctor, who is more likely to get the osteoporosis?
As I told you, premature menopause, if the lady keeps on menstruating till the age of 50 or 55, that's good for her bone, for her health. But suppose for some reason, there are ladies who may have premature menopause, which could be natural, means by the age of 40 and 42, she started to get her menses very lesser, scanty, and now she is not bleeding at all. So this lady. Second, most is like, when these ladies have undergone some surgical procedure, like we gynecologists deal with ladies who have something wrong with their uterus, the endometrial hyperplasia, there was an ovarian cyst, or there could be cancers of the uterus and ovary, and this lady had to undergo surgical procedure which is called as hysterectomy, with removal of her ovaries disease that is called as bilateral oophorectomy. This basically becomes a sudden menopause, means her hormones were at her peak at the age of 40-45, and for some reason she had to undergo a procedure where we had to remove her ovaries. Her hormone from an optimal level would suddenly go down. So this lady may face a lot of menopausal changes and the symptoms would come up in 2 to 3 months. So these ladies, we are usually careful that after they have got operated, we do put them on calcium supplements. They may sometimes even need HRT, hormone replacement therapy, to make this next 2-3 years of her life and her bone age to be smoother.
Doctor, how can osteoporosis diagnose?
Osteoporosis is diagnosed mainly, especially when these ladies come with an fracture of either the spine or the hip joint or the knee joint. Usually it is nothing very major trauma. They just happen to slip. They went for a walk in the garden and they landed up with a fracture. So these are the most common, and swelling and pain of the knee joint. These are the most presenting symptoms of the ladies.
Yes, doctor. And doctor, what are the risk factors of osteoporosis?
As I told you, risk factor, age is the major risk factor for all general population. Like the men and the women, everybody, as we age, we are prone to osteoporosis. But somebody with medical disorders, like as I told you, ulcerative colitis, somebody with thyroid disorders, parathyroid hormone disorders, vitamin D3 deficiency, vitamin B12 deficiency, calcium and phosphorus are most important elements for bone formation. Then people now especially go on a crash diet, like they would go something like vegan diet, there are no milk products, somebody would go completely vegetarian, so there is deficiency of vitamin B12. If the diet does not incorporate good quality proteins, there is muscle wasting, and all these multi-nutritional changes does make osteoporosis more prone.
Alright, thank you, doctor. And doctor, what are the other treatment options to stop the development of osteoporosis?
So as we say, osteoporosis of course can be prevented. It cannot be completely eliminated, but we could control the symptoms if we start preventive measures early. Like even younger population, or especially a lady above 40, what happens is the basal metabolic rate decreases by 1 to 2% for everybody. Means most of the ladies complain, doctor, I am eating the same amount of food, I am doing the same household chores, my office work, but still I am gaining weight, I have landed up with pains and ache. That is because weight gain is a pure important factor which could predispose her knees and her hip joint and the spine to more of trauma. So she would need to first control her weight. Every lady would need to make some dietary changes to help her osteoporosis to be delayed, like a high calcium diet, all milk products, people who eat non-vegetarian food. Eggs are a very good source of calcium, phosphorus and vitamin D3, liver, red meat. For vegetarians, it's lots of sprouts and nuts, especially the walnut and almonds. They are rich in antioxidant, they are rich in calcium. Protein is there in all kinds of cereals and pulses, all kinds of dal would help them to increase their protein content.
Yes, doctor. And doctor, what are biphosphonates?
Biphosphonates are basically drugs and medicines which would help in bone development. Like as I told you, there is a continuous remodeling. There is some amount of bone reabsorption and bone development. This biphosphonates would help a lady to decrease her bone absorption and increase the bone formation. So the bones become a little stronger, especially it is given to ladies who have severe osteoporosis, there is fracture, there is any surgery done on the bone. So we need lot of medicines apart from the calcium dose to help the bone formation.
Yes, doctor. And doctor, what are SERMs?
SERMs are basically selective estrogen receptor immunomodulators. Basically, as I told you, during menopause there is less of estrogen, and the function of estrogen was to help in calcium absorption and bone formation. So these SERMs basically help you to help in the bone formation.
And doctor, osteoporosis?
As we know, it's the calcium and phosphorus, vitamin D3, which are the basic elements needed for bone formation. The calcium requirement per day is almost 1,300 milligrams per day, and our dietary calcium is usually not able to suffice a whole 1.3 grams of calcium. So our diet we of course pay a lot of attention to the diet would be rich in calcium, but we would need to take calcium supplements which would suffice at least 1,000 milligram calcium per day. You need vitamin D3 for calcium absorption. So countries which are tropical with brown skin, we may not absorb the sunlight very well. That's the reason almost 20 to 30% of our population would be deficient in vitamin D3, and it is the exposure to the sun, like between the 10 o'clock to 7 to 10 o'clock and 2 to 4 o'clock. That amount of sunshine to the skin, exposure of almost 80% of the body skin would help us to get the daily requirement of vitamin D3. When this is not possible, as we stay indoors, long working hours, we say taking vitamin D3 supplements helps in calcium absorption and prevention of osteoporosis.
Okay, doctor. And doctor, how long it will take to treat the osteoporosis?
Now, as I told you, it's a gradual process, so even the recovery would be gradual. Every lady who's been told that her bones are a little weaker, she will start taking her calcium supplement, that is 1,000 milligram per day and 2,000 international units of vitamin D3 every day. She will have to increase her protein intake because joints and muscle joints needs bone and muscle support both. So we say that gradually she would have to start muscle training programs also. Basically, bone needs a lot of exercises which would be like maybe walking for 30 minutes to 45 minutes per day, or maybe at least 3 times or 4 times per week. Then for her muscle tone and muscle health, she would need to do some weight training. Like, it could be just maybe 2.5 kgs or 5 kgs of dumbbells which could help her strengthen her upper limbs, her lower gluteus, the quadriceps. Doing lot of weight bearing exercise, it would also help him to increase the bone stability, the joint stability, especially of the knee joint and the hip joint.
Okay, thank you, doctor. And doctor, should one be tested for osteoporosis?
Yes, in the younger population, I said, like when somebody is in their 20s and 30s, we would not test them, but somebody with any kind of disorder, especially the parathyroid hormone disorders, or with multiple history of fractures, should be investigated for osteoporosis. Ladies after the age of 50-55 should be getting an annual health check, which would, apart from their routine gynec checkup, should have the bone health also.
Yes, doctor. And doctor, should one consider hormone therapy?
Now, as I was telling, estrogen and progesterone hormones, they get deficient after menopause. So when you're talking about HRT, that is hormone replacement therapy, this is basically if a lady, especially if she's undergone a surgical procedure where she had a surgical oophorectomy and her hormones have gone down considerably, that's the time we may recommend HRT to this lady for her bone health. Basically, HRT includes the same hormones, is the conjugated estrogen and the progesterone which we give. Basically, she would start getting back her menstrual bleeding again when she's put on this HRT. Estrogen is basically conjugated estrogen, which is 0.625 milligram per day. So we give it for continuous 25 days. And if the lady's uterus is present, we give her an progesterone, medroxyprogesterone 10 milligram for the last 15 days to induce bleeding, so that her uterus does not undergo a lot of hyperplasia in the endometrium. So that is about HRT. Means this lady will take this medicine all throughout the month. She would bleed in the last 5 days, and she could continue it for minimum 1 to 3 years, as long as even 5 years.
And the benefits of the hormone therapy?
As I told you, this hormones, the lady has to be counseled that she would be starting to get her menstrual cycle again, because we are giving her the same estrogen progesterone hormone. Second, what are the benefits? Like, it would help in her other menopausal changes also. Like, it helps in keeping her bone health good, her urogenital system, her urinary symptoms, her skin, her hair. would feel better. Her vaginal discharges, her vaginal secretions remain the same. It also helps to maintain the sex life and the libido. Her urinary complaints like increased frequency or difficulty in holding urine would be lesser. Her bone and her lipid profile is definitely benefited by HRT.
Alright, doctor. And doctor, is there a safe alternative to hormone therapy?
As we told, certain side effects of HRT could be there. Means she has to be more careful about her breast health. She would undergo an annual health checkup, get a sonomammography done. She would get her ultrasound done for the ovarian size and her endometrial thickness to look for any endometrial hyperplasia. And suppose a lady who is not fit to take HRT because she is a known case of uncontrolled hypertension, there is a cardiovascular disease, she has undergone some cardiac wall replacement, or she is a known case of some kind of cancer, she had history of breast cancer, colon cancer, then these ladies or uncontrolled diabetes would not be put on HRT. So for them, we could give an alternative like phytoestrogens. We have a lot of plant-based estrogen, like you have flax seeds, you have soya beans, you have soya products, soya milk, tofus. All these are basically phytoestrogens which could help the lady to get the same benefit as an HRT would give her.
Alright, doctor. And doctor, what are the general recommendations for the exercise to treat the osteoporosis?
Now osteoporosis, as we say, by the age of 45-50 it would start coming up. The lady would be a little mindful first of her weight. She would have to control her weight by making some dietary changes, like her dietary should have less of carbohydrates. It could be little high quality protein, more of calcium, and milk products, especially like it could be curd, it could be cotton cheese, which would help her to improve her calcium supplements. Regarding exercises, it should be a mixture of cardio and weight bearing exercise. It would be like finding a good trainer would definitely go a long way, taking a professional help. But in general, a lady could understand that she has to combine, she should have a combination of both cardio and weight bearing exercises. Maybe first she could start with walking half an hour every alternate day in a week. Then in the alternate day, she could start using her muscles. She could improve her muscle strength by doing her upper body and lower body exercises. Upper body, you have to pay attention to your biceps, your triceps and your chest muscle. Core strengthening is the most important part of any kind of training, because it's the maximum weight gain or the fat deposition happens in the belly and the breast of the lady. So taking care of the fat diet would definitely help in strengthening her muscles.
Reduce the risk of osteoporosis during menopause.
So every lady should be getting a routine health check. Means she should know her hemoglobin, her thyroid, her vitamin B12, vitamin D3 levels, serum calcium levels, thyroid hormone, parathyroid hormone. These are routine health checks, blood check which she will be doing. Apart from the routine health check which she has ultrasound for her abdomen and pelvis to look at her ovaries or uterus, any kind of cancers in the body should be annually checked. CA125 is an ovarian tumor marker which we say you should be doing it after menopause every year, or if it's normal every third year, to check for any ovarian neoplasm. Other preventive methods is like starting early intervention, like by the age of 40 the lady should be aware that she needs more muscle strengthening and bone strengthening exercises. Taking calcium supplement from the age of 45 would definitely help in keeping her bone density stronger.
Thank you, doctor, for sharing your views on it. And I hope this session was really helpful and informative to all the viewers out there. So doctor, before leaving, is there anything else that you would like to share with our viewers?
I would say every lady, whatever age, she would first should pay a lot of attention to her physical and mental health, and both go hand in hand. Mental health, nowadays we see a lot of teenagers and youngsters facing hormonal changes like polycystic ovarian syndrome. They face weight gain issues. Then there is hormonal changes which can give them mood swings. A lot of career decisions have to be taken. And in all this long working hours, a lot of ladies, and when the ladies are married with kids and family, a lot of multitasking, they somewhere lose track of keeping their weight under control. looking at their dietary needs, they lose track of exercises. So I would advise every lady that whatever age, every girl, every lady, whatever age, especially after menopause, will have to pay attention to lead a good quality of life after menopause also.
Well, doctor, that was really a great response, and it means really a lot to us to be with you in a Narikaa Talk Show, and thanks a lot for your precious time. So we will all see you in next session with another interesting topic. Till then, to all the lovely viewers,